Welcome to another episode of the Aig-Imoukhuede Foundation podcast. Today, we are taking you inside the AIG Public Leaders Programme, a world-class executive leadership development initiative designed to equip Africa's brightest public sector leaders with the skills to drive real change. We recently celebrated the graduation of the fourth cohort of AIG Public Leaders Programme. It was truly inspiring to read about the reform projects, a key program requirement that our formidable 68 participants have initiated across their ministries, departments, and agencies and are committed to institutionalizing. Today, we have three outstanding participants who emerged with the top innovative reform projects from this latest cohort. Let me introduce you to our guests. Our first guest today is Dr. Akanimo Usoro. Dr. Akanimo Usoro is a renowned economist, technology strategist, and project management expert with extensive experience driving transformative initiatives in the public sector. He holds a PhD in economics and has spent over a decade at the Central Bank of Nigeria, where he has played a key role in digital transformation, operational efficiency, and institutional reforms. Currently working in the office of the Deputy Governor of Corporate Services, Dr. Usoro specializes in service optimization to enhance operational efficiency and institutional transparency at the CBN. Previously, as the technical assistant to the Deputy Governor of Operations, he led an automotive initiative that streamlined processes, improved turnaround times, and generated significant cost savings. His ability to blend technology with economic insights has contributed to the successful execution of large-scale digital transformation projects. He is a certified project management professional from the Project Management Institute and a certified organizational culture expert, bringing a unique combination of technical expertise and economic acumen to his role at CBN. With a passion for innovation, mentoring, and data-driven decision-making, Dr. Usoro remains committed to shaping the future of Nigeria's public sector. You're welcome, sir.
It's my pleasure to be here. Thank you.
Our second guest is Dr. Fatima Ali. Dr. Fatima Ali is a dedicated consultant psychiatrist at the Federal Neuro Psychiatric Hospital, Maiduguri, over a decade of expertise in mental health and humanitarian services. Growing up in Maiduguri, Borno State, she developed a deep understanding of the impact of conflict, particularly on vulnerable women and children, fueling her commitment to serve her community. Through her career, she has consistently upheld ethical leadership and integrity, exemplified by her efforts to promote transparency during her time as Chief Resident Doctor. Dr. Ali has extensive experience as a frontline mental health professional in emergency response projects with organizations like the World Health Organization and United Nations Population Fund during the Boko Haram crisis. She is a wife, a mother, passionately driven to build inclusive healthcare systems that prioritizes the need of the most marginalized populations. You're welcome, ma.
Thank you, Fortune, for having me. It's a pleasure.
Titilola Vivour-Adeniyi, also known as the Merchant of Hope, has spent about 15 years in public service, where she has served Lagos State government in different capacities. Her experience cuts across public policy formulation and public administration, as well as legal expertise and social services. She has been instrumental in ensuring a proactive and coordinated response to sexual and gender-based violence in Lagos State. She currently serves as the Pioneer Executive Secretary of the Lagos State Domestic and Sexual Violence Agency, where she leads a team of over 100 dedicated professionals. She is an author of several books for children on domestic violence, civic education, sexual violence, and self-love and body safety. More recently, she published a memoir in a book titled Living for a Higher Purpose, Inspiring Hope through the Nigerian Public Service. As a consultant, she has worked with national and international organizations, including the British Council, the World Bank, and on several United Nations projects. Titilola is an alumnus of Middlesex University and is currently pursuing a master's degree in international relations. She's also an alumnus of prestigious leadership and governance programs, including the School of Politics, Policy and Governance (SPPG), the London School of Economics, Said Business School, and the University of Oxford. You're welcome, ma.
Thank you so much for having me.
Together, we will dive into their experiences, what inspired their projects, and their aspirations for the future. And if you are listening and considering applying for the program, stay with us. We will tell you how you can be part of this transformative journey. Let's begin with a quick icebreaker. If you had to describe your AIG Public Leaders Programme experience in one word, what would it be and why? Dr. Akanimo.
Thank you, Fortune. If I had to choose one word, I would say it was truly transformational. The AIG Public Leaders Programme wasn't just about acquiring knowledge. It was about challenging perspectives, refining leadership approach, and equipping me and everyone that participated with the practical tools required to drive real reforms in our institutions. The experience pushed me beyond just conventional solutions to, thinking of developing a project that has the potential to enhance governance and institutional efficiency. The depth of engagement with the world-class faculty from Oxford University provided an opportunity to learn. And apart from that, we had the opportunity to collaborate with other brilliant public sector leaders and also to focus on real-world impact. This, for me, was truly transformational. Thank you.
Thank you very much, sir. Dr. Fatima.
Thank you very much, Fortune, once again. For me, it would have to be reawakening. I say that because what the AIG program has done for me, just like the earlier speaker said, it's not only about the knowledge, but it has reaffirmed my sense of what it means to be a public servant and why we do the things we do. The program came for me at a time when I needed it most, because most times when you try your best, you try to serve and you have some beliefs that are driving you, you try hard, but at some point you just feel it's not matching up with the efforts you're putting in. You begin to have doubts in yourself, and then you begin to lose some kind of confidence. So what the AIG program did for me was to boost up my confidence, remind me of why I'm doing what I do, and then it also gave me an opportunity to add my knowledge while networking with other colleagues. So I would say it's truly reawakening for me, and it has reminded me of what it means to be a public servant. Thank you.
Thank you very much, madam. Titilola.
Inspiring, because the whole program, right from the application process to when we received the notification that we had been selected, to the physical classes, online classes, and then the graduation ceremony, it was just very inspirational. So it's one word is very inspiring.
Thank you very much for that. Now, let us go back to the beginning. Titilola, what motivated you to apply for the program? Did you have a particular vision for how it could help you drive transformation in your public sector role?
So a colleague of mine had sent me the ad and had encouraged me to apply. And so when I went online, I went to the website. I just had a glance of what the program offers, and I was very encouraged to apply. The fact that we're going to be talking about integrity, communication, digital transformation, those are areas that are very relevant in leadership. And to be honest, I wanted to also hone my leadership experience, rather my leadership qualities. Just basically prepare for whatever lies ahead of me. So that's why I applied, because of the rich curriculum, and also an opportunity to network, right, to meet other colleagues across the country working in different sectors. It's important for us to have that community of like-minded people that we can draw inspiration from as we journey in this public service journey. So yeah, that's why I applied.
Thank you very much. Indeed, the program offers a rich curriculum, and just as you've mentioned, collaboration, partnership, meeting with like-minded professionals is something that is key. Now to the next question. Dr. Akanimo, looking back, what was the biggest takeaway from your time in the program? Was there a concept, framework, or lesson that completely changed how you see leadership?
Looking back, I would say my biggest takeaway from the AIG Public Leaders Programme is the importance of balancing informal and formal practices in driving sustainable change in the public service. Let me just try to elaborate more on that. When I talk about formal practices, it's just about the formal rules and policies that we have in our various institutions, and we tend to focus more on this. My time in AIG Public Leadership Programme, I learned that it is not just about the formal rules. There is also the informal practices, which refer to unwritten rules, behaviors, and cultural dynamics within an organization that help shape an organization. Unlike the formal policies that we have in place, which are documented and measurable, informal practices are not documented. They run in the background and they influence decision making and workplace culture. And overall, there's a great influence on performance. Though the informal practices are not written down, it has a high influence on shaping an organization. So my biggest takeaway was that there need to be a balance between formal practices and informal practices. As a leader, you need to consider both if you really want to drive a sustainable change. Thank you.
Thank you for that response, sir. We are glad to know that the program was able to bring that out, and you've used it not just in the implementation of this reform initiative, but others to come. Okay, let us get into your reform projects. Could each of you walk us through your project? What problem does it address, and why is it critical for Africa's development? We will start with Dr. Fatima.
So my project is a build-up on a pilot project. So it is a project leveraging digital tools to improve mental health access, especially in children and adolescents. So this project is specially designed, although it's scalable for all age groups, but it's specially designed for children and adolescents, because when we talk about mental health challenges and psychosocial issues, most mental health challenges from studies and from experiences start about almost 2/3 start in that age group. So, and then it's important to catch them young, to give timely intervention, but you can't do that without access. So, and then considering the context in which my environment is and the security challenges of over a decade and a half which has been ongoing in my area, it was access is generally a problem when it comes to mental health generally in sub-Saharan and other African countries. But then when you have security challenges, what this does is that it further makes the services inaccessible. So the initial project was based on using a digital tool for screening and then targeting those children and adolescents with high risk of developing mental health challenges or who have already developed these challenges. So together with other public health methods, what it does is it's other aspects of the project, such as the task sharing. So this entails delegation, training other non-professional mental health workers with skills that will equip them to at least identify and use this digital tool to get those group of children. So what my project did was to further make this accessible by initiating teleconsultation coupled with those initial efforts. And then by doing that, what it does is initially when these children that had such problems were identified, they had to be referred and they had to be transported at some point to the urban area where the mental health services were accessible. And these mental health challenges, the services needed to address these mental health challenges are needed most in these remote areas, because that's where you don't have those specialists, you don't have the infrastructure for the management of these disorders. So by the time you introduce teleconsultation, bringing it to and making it accessible at their doorstep, you're circumventing a whole lot of problems, issues like security challenges. You're addressing issues like bringing down the cost of transportation and the whole management, because most of these problems are chronic in nature. So it's not something that is one time, and so by doing that, you're really making it easier and more accessible. Then also, part of the initiative was bringing in school-based intervention. That's adding to the task sharing because children and adolescents, you realize that they spend most of their time in schools. So it's not just getting them in the community they stay. At some point, most of the children will be in school. So equipping this, empowering these teachers by making them able to identify at-risk children or children that have already developed these problems, you have in a way increased the capacity, the people that are able to identify these challenges. And then by strengthening the referral link between the teachers and other community health workers, psychiatric nurses who were already incorporated in the project, you have brought in another kind of partnership, strengthening the referral link and making it more sustainable. So if we look at this project, what it really does is it's building on infrastructure and in terms of human resource, in terms of other resources that are needed but are not that are inadequate, I should say. You have some level of resources that you have, but they are not enough. And then mostly they are concentrated in the urban areas. But then you have remote areas and areas that need these services more, but it is inaccessible to them. So what this project does is it makes it more accessible, bringing it to them in a timely manner. And so by using this existing infrastructure and resources that we have, what you're doing is you're strengthening I'm strengthening my organizational goal of improving in the long term the mental health outcomes of citizens that are living in the community. And then it's scalable because we can build it up to include other ages. It is replicable in other areas because we're using MDAs, partnerships that exist not just in other regions of Nigeria, but almost everywhere in the world, where you can find community health workers, you can find psychiatric nurses, you can find all these resources, the Ministry of Education. So it's replicable everywhere. So I think considering all this, I think it's achievable because we're already doing it. But with the right partnerships, meaningful partnerships, dedication, I think it can go a long way in addressing most of the challenges we face in making healthcare accessible, especially in times where there are global challenges exacerbating these mental health challenges. Thank you.
Thank you very much, madam. That was quite commendable, and especially taking into consideration the humanitarian crisis in Borno State. I can only imagine. Thank you very much. Titilola.
So my project is basically leveraging digital technology to bring access to information to survivors of sexual and gender-based violence. I wanted a situation where I can put, my office can put the power back in the hands of victims and survivors to help them to be in charge of the reporting process. So before now, you have maybe people coming into the office, which is fine, or people calling the toll-free line, which is also fine. But I realized that part of recovery for a victim or a survivor, and this is obviously based on feedback that we have received over the years, is to put them really in charge of the process of accessing help. So they don't feel like, again, their agency and their self-determination has been taken away from them. And what better way to do this than leveraging technology to drive this important reform? So basically, it's a tool that is part of our existing mobile application, where if a person has experienced either domestic or sexual violence, or someone knows who has experienced domestic and sexual violence and wants to report, then that person can go online, fill in the details, and the report is done. But most importantly, what the tool seeks to do is to help the survivor to document and preserve evidence. Now, this is important, especially for domestic violence, because about 60% of cases that come to us, there's no real evidence to authenticate or corroborate what they are saying they have experienced, right? And this is for different reasons. Sometimes they take pictures and then maybe the abuser smashes the phone, or they themselves delete the pictures because they have sort of reconciled and they believe that all is well. But what we're saying is that hinders us because when it's time for us to address the case, investigate the case, we don't have real evidence. And at that point, it's about he did it, I did not do it, or she did it, she did not do it. So what this does, aside from also giving an opportunity for the survivor to document, which we found is therapeutic, it's also an opportunity or a platform where they can upload the evidence. It can be pictorial evidence, audio, if there's an audio recording, documentary evidence can be uploaded. If there's a medical report, either from the police or the hospital, or even a chat where the suspect or the alleged abuser is confessing to, being violent or to the crime. So that's going to be with us, and the survivor does not necessarily have to prosecute immediately. It's stored. So whenever they are ready to come forward and, ensure the case is investigated, that information, that evidence, that data is safe. So that's the essence of my project.
Thank you so much. That is an innovative project indeed. Dr. Akanimo, same question.
Okay, thank you, Fortune. Thank you, Fortune. My capstone project was about harnessing technology for effective and efficient document management in the CBN. And I was truly honored to have my project recognized as the best reform project in my cohort. But I have to say this, that of all the 68 capstone projects presented, all of them had the potential of being the best. They are truly transformational projects that, if implemented, will bring about a positive change in the public service. I learned a lot from the Public Leaders Programme, and those lessons I applied to my project, and that's why my project has been very successful. Particularly, there's a session that we had on harnessing digital technology. That session was led by Aaron. And the takeaway I had from that session really emphasized on implementing digital transformation in a way that is truly transformational. What that means is that, digital technology automation is not just about automating and copying the manual process and implementing it digitally. It is about automating in such a way that you take out the inefficiencies that are embedded in the manual process before you complete your automation. Prior to this time, the knowledge I had, also I have an IT background, was just, okay, what we have on paper, let's just automate it. But from the lessons I learned, I now know that in the process of automation, you need to expunge, take out the inefficiencies embedded in the manual process, because if you don't do that, your digitization will not be truly transformational. And also, when we're talking about emerging themes and next steps for discussion, this really helped me in my project, because I learned that for digital reforms to be sustainable, first, we have to address real organizational challenges, and then we have to integrate it with existing processes, and then design it with a clear understanding of institutional constraints. And one of the institutional constraints is getting stakeholder buy-in early in the project. And that's what I did. Applying this, it provided a clear direction, a clear framework, and this has helped me with my automation project and with driving digital transformation in my organization. Thank you.
Thank you very much, sir. That is quite noteworthy. Just a quick follow-up, sir. What would you say was the impact of your intervention?
Thank you. So, the impact, we have started a pilot run, because also one of the things I learned was that you can use a structured approach, not using a big bang approach, starting small and then scaling. So we are scaling with some departments in my organization and monitoring progress, monitoring how the usage is. And in the next 3 months, we are going to scale to another 11 additional departments. And in 6 months, we are supposed to cover the entire organization. Once we are done with that, then it will be a success story that can be adopted by other institutions. Thank you.
Thank you very much. Indeed, a very transformative reform initiative. How did the program's curriculum influence your choice of project or the strategy you took to tackle the identified issue at CBN?
The curriculum is very rich, and apart from being rich, it applies real world. It's a kind of real world simulation. It's not just based on theory or paperwork, but there's a process of identifying a problem in your organization and then working out a solution that is implementable. So the fact that the program was like we had practical sessions and practical brainstorming. This helped me, with the ideation of my project. It also helped me with driving the implementation. As I mentioned earlier on, stakeholder engagement, especially earlier on, is very important, and at times this is what determines the success or the failure of a project. And I had to apply what I learned from this program by engaging stakeholders earlier on, passing that project over to them to own it as well. So it's a kind of co-ownership arrangement, and that helped with the success of this project. Thank you.
Thank you, sir. Okay, the next question is for Dr. Fatima. Dr. Fatima, while you were speaking about your project, you made mention of working with various organizations from community level to the state level, even public schools, and also community organizations and traditional organizations. So we would like to find out, Dr. Fatima, how did you engage stakeholders, build partnerships, or rally support for your reform projects within your organization?
Thank you, Fortune, for that question. If you recall, I mentioned that this project is a build-up on a pilot project. But I'm particularly grateful for this question because it happened that while the pilot project, while I was working with the pilot project, I happened to also be the project manager. So I'm particularly grateful for the AIG Public Leaders Programme and with their Oxford team for equipping us and making us realize that knowledge is not just to be assimilated, but for it to be meaningful, for it to have impact, it has to be coupled by the use of this knowledge to tackle real life problems. So your question on stakeholder engagement, I would say it wasn't easy, but it wasn't impossible because these stakeholders are already parties and organizations that have an interest in this project. So through identifying the best way to effectively communicate with each stakeholder and at each engagement level, either informally or formally, was very crucial. And this is something that we learned from the AIG program. Our perspectives were broadened. We were enriched with knowledge. We were shown the importance of using both formally and informally. Because if you realize in organizations, mostly you see sometimes we are being lopsided, focusing mostly on the formal ways of communication, and even while we use the informal means, we don't really recognize or we don't really give importance to that area. But what this program did was it reminded us why we're using this and showing us the importance and showing us how to effectively use these skills. So for each, like I said, for each engagement level, this project is a project that, as the expert, is your area. You have much information on how to go about it. The innovation and initiative mostly is from your area of expertise. So, but without effectively communicating with the stakeholders and telling them why this is important, either through giving them scientific evidence and bringing in to their awareness how they are important in this project without giving them that information, your project will not likely succeed. So in the initial phase, informing them using effective communication skills, either through negotiation, either through sending proposals, paying courtesy visits, was very important. We made a lot of consultations, seeking input and feedback from the stakeholders on their decision and plans. This was something that we really did during the pilot project, because while we were piloting the project, there were a lot of challenges that were coming up that we initially hadn't given considerations to, and then with impact, with feedback from other partners, these were areas that really made their contributions were considered, and some meaningful insights were gained. And then while consulting and informing them, also involving them, actively engaging the stakeholders in planning and decision-making process. This is something that it's done at all levels of the community, at individual, societal, like, we are using structures like schools. So you have to tell them why it is important and why you are actively engaging them. Let them have ownership. Let them know they are also responsible to some extent. This is not just your project. Everybody, every stakeholder, every partner, every MDA, department, sector has something to gain from this, and with meaningful collaboration, this can be achieved. And I would say that a very important lesson, one thing with operational research piloting projects, is you learn a lot while you're piloting. It's a problem you want to address, but while addressing the particular problem that was your initial goal, you find out that you gain a lot of experience from the wealth of experience that you already had. And then with collaboration, a lot of insights, perspective, and all this is really appreciated, and it really is really impactful when there's that effective communication. When each stakeholder recognizes their weight, the weight they carry, the possibilities of collaborating and actually being dedicated in the project, then I would say the sky is just the starting point. Because I started this project is a build-up, so my pilot project started before the finishing of the Public Leaders Programme, but immediately after the Public Leaders Programme, I think it was on a Monday, when I came back to Maiduguri, we launched the project. So what we had to do was just re-invite these people with the new innovation, take them over again. Along the pilot project, while we were doing it, we kept on giving reports. So they were already in tune with what we were doing. But with the new innovation, we further showed them this is why we are doing this, adding this on top. Because during the pilot project, we reached out to about 29,000 children who had special needs. So with the initiation, we were telling them this is what they'll be getting, this is how it will be better, and then involving them, making them see it. And I think from the beginning of the project, we're still doing, right now as I'm speaking to you, I'm in another local government area, trying to carry out some aspects of the project like the awareness, sensitization. And children are closing school early. So, but we've already identified the primary health care that we want to be referring these children to, so that there can be a central area, even in the remote areas, where when we screen the children, we can have specialists with the help of the psychiatric nurses through teleconsultations. We can gather them, if possible, in these primary health communities if school is not in session, so that there won't be a break in the interventions that we're having. So, and the one thing that I'm particularly grateful for this program is, even while we were presenting our our projects, I remember there were a lot of questions that some picked some of the potential areas where I would likely have some challenge or areas that I could improve on. And from the panel of judges, from other people that had questions, there were a lot that I still picked from there, because a lot of emphasis was now paid on we need to supervise. Although, we are using standard methods, and primary healthcare, there's already an intervention guide on how to train these nurses, their limits. But with that emphasis, it has even made me to be more conscious of, while doing the teleconsultations, we still have to be getting reports from people we're working with, actively supervising them, monitoring what they're doing, from time to time evaluating what they're doing. So even while we were being judged, I was getting a lot of knowledge on how I could improve this project. And right now, I would say I'm using it, and I'm actually very grateful for. So it has really been an inspiring experience, and I'm really grateful for this program. Thank you.
Thank you very much, madam. That was quite robust. I can only imagine the amount of work that was put into that, covering the various stakeholders across various levels. Sustainability is key for any reform project. What innovative approaches are you using to ensure your project has a lasting impact?
Thank you, Fortune, for that question. Sustainability is indeed critical for any reform, and ensuring that any project has a lasting, or every project have a lasting impact should be a priority. For me, based on the lessons from the AIG Public Leaders Programme, I had sustainability as a key priority from start. And to achieve this, I focused on what I call institutional integration, stakeholder engagement and ownership, and then adaptability. So let me try to explain what I mean. The way the project was designed was in a way that it was fully embedded within existing institutional framework, rather than just designing a project that operates as an external initiative. I was able to align with ongoing policies, processes, and structures. So this actually positioned the project to endure beyond maybe the leadership that we have now. So even if there's a leadership change, it won't affect this project, because it was designed to embed within it the existing institutional framework. The second thing was that of which I've mentioned before, relating to a broad stakeholder engagement and ownership. So right from the beginning, I had it at the back of my mind to build a buy-in from first leadership, second operational teams, and then the end users. Especially the end users, because no matter how good a product is, if people are not using it, it's more of it has failed. So one key strategy was co-designing approach. So we called in the stakeholders into a room, and we got ideas from them. Based on that idea, we're able to design the solution. And once the stakeholders know that this is their idea, this is part of their idea, they were able to embrace it and use it. The last thing I want to mention is data-driven adaptability, which has to do with real-time monitoring, receiving feedbacks, and then having more of a performance dashboard to ensure that there's continuous improvement and responsiveness to emerging challenges. Thank you.
Dr. Fatima.
Thank you, Fortune. I would say I couldn't agree more with Dr. Akanimo, because while I was explaining my project, I mentioned that is something that is already existing, is a build-up. So it's something that my organization, a key goal of my organization is to eventually improve the mental health outcome of citizens. So this is something that we already do. It's already within the institutional framework. Most of the resources that we're using, they already exist. And then if you look at it again also, giving ownership. Yes, he mentioned that, but I would like to reiterate the emphasis and emphasize the importance of giving ownership to stakeholders. If you notice, all these stakeholders, most of them, because the project, I said, it transcends down through the community, so it's involving a lot of sectors, partnerships, because I mentioned even in this project there's also a not-for-profit non-governmental organization that is also a partner, Ministry of Education, Ministry of Health, different kinds of stakeholders, even teachers, and at a point even parents, because most of these children will be, while you're consulting them, they are together with their parents. So giving stakeholders ownership and showing them that this is also their responsibility, this is something they can do, encouraging them, showing them that everybody has something to gain from it, motivating them and seeing, and I mean, a project that is ongoing and is beneficial to everyone, the natural thing is for people to adopt it. And then again, I've mentioned that it is scalable, it is replicable. This in itself is a measure to make it more sustainable. And then with the use of technology as we are seeing it now is only getting better. Even in the medical field, we can see that it's making things easier, making things more accessible, making it better. So we'll have to agree that if you look at the design of our projects, most of the designs, in fact, I would say almost all the 68 projects were designed that way, because part of the program really emphasized on the need for sustainability. There's no point in doing an absolutely good, wonderful job, but that just lasts for some time, and then maybe after, when you're not in leadership, it can't exist without you. There's actually no point in building a project like that. So, but if you look at our projects, with respect to Dr. Akanimo, by the way, I would have to say he was a very formidable opponent. He didn't make it easy, and I appreciate his work. If you look at all these projects, from their design, the designers had sustainability in mind from the design. And if you look at the methods being used, you would have to agree that these projects are sustainable. And this is something that we should be grateful for, having the experience of the AIG PLP Public Leaders Programme, because it's something that we were reminded of the usefulness. There were a lot of sessions that were bringing in real life experiences, bringing into context things that you naturally experience, foreseeing challenges that when you go to the field and you know that these are the things that in everyday practice, these are the challenges that you face. This program really brought them to light and challenged our thinking, made us to be proactive rather than reactive in our designs for our project and all that. So, and I think sustainability was a core part of that training. Thank you.
Very true, Doctor. Thank you very much. Titilola.
So, as I said, the project is it's an addendum to an existing project, which is, an annual project which is embedded in our budget line, right? So we didn't create a new project that will now be thinking of sustainability or thinking about funding. basically leverage what is currently already in existence. So in terms of sustainability, there are no issues with that because it's an existing project that we've added, included an added feature of. So we're good in terms of sustainability. I think in terms of scalability, because we have sort of become a reference point for other states who are desirous of, replicating similar structures in their states. So we have different states coming to understudy what we're doing in Lagos State, how we're grappling with this vicious menace. So it's an opportunity that can be scaled to other states if they are willing, and it's just about creating subdomains or just linking them up with the developer to assist them in developing a tool that is nuanced to their peculiar environment. So in terms of sustainability, it's part of an existing project which is subvented for annually. But in terms of scalability, it's dependent on other states that may be desirous of adopting same in their states.
Thank you very much for that. Indeed, as the saying goes, you may not need to reinvent the wheel all the time. One little idea here and there on already existing processes can bring change and, of course, impact, just as we are seeing with your project. Thank you. All right, let's switch things up with some rapid fire questions. You need to answer these 3 questions under 1 minute. Titilola will go first, Dr. Fatima next, and Dr. Akanimo will finish up. 1. What is one topic from the program that completely changed your mindset? 2. What's one skill you gained that you would carry forward in your career? 3, and not the last, please share a message to aspiring public sector leaders in Africa.
Okay, the first one will be communication, storytelling, the art of storytelling. That was phenomenal. The second one of the main things I gained, empathy. A leader must be, lead with empathy. It's not, you're not being weak by being a leader with empathy or leading with love. So I took that, and I've already started practicing that. In terms of what I would say to African leaders, we set the pace. Public servants determine economic prosperity, economic growth and development. And we have a huge calling, and that's why it's service, it's public service. We're doing this because we are here to impact lives, and little steps we take now may have monumental impact, maybe not immediately, but in the future. So it's important for us to continue to hone our skills, continue to learn about innovative ways to address issues that affect all of us, albeit in different ways, leverage community, and just irrespective of the challenges, the circumstances that we may face, we must always remember why we chose to do what we are doing, which is to live a life of service.
Thank you so much for that. Indeed, we must live a life for service, selflessness, service to humanity. Thank you so much, Titilola.
Thank you.
Dr. Fatima.
Thank you. The topic that really changed my perspective, I would have to say, is integrity in public life. Because there were a lot of things that I learned that it's not as simple as we think. Your personal integrity might not have to align with the integrity while leading an integrity in public life. So I really had some rearrangements in my schema of thought for integrity in public life. And then the skill that I would say I developed more and I'm very grateful for was the effective communication, both the informal and the formal communications. I learned, I believe now I'm a better communicator. I want to believe that, and I'm still improving. I'm still trying to make better that my skill of communication. And then what I would tell other leaders is what I will encourage them to, there is no better investment than investing in yourself and people around you. I mean, I know that the AIG Public Leaders Programme is not so popular in my area, but I knew somebody that had benefited from it, and I could see real improvements in what he was doing, how he was serving, and that caught my interest. I approached him, he encouraged me, and initially I was feeling like, okay, I'm not sponsored from my organization and all that, but we know that capacity building at various levels sometimes is being sponsored by your organization, but most times you would have to go an extra mile to invest in adding your skills, adding your capabilities. So invest in that, and while you're investing in that, try to make others see the value of this investment. If I hadn't seen remarkable changes in that other person that I said I knew had, probably I wouldn't have paid any attention to it. But this was something that was showing, and I knew it was worth it. So while he was using it to improve on himself, it wasn't only about himself. It was showing, he was leading people better. Other people he was leading by example. So by investing yourself and then actively using that investment to bring other people on board, I think with that, I would say a lot could be achieved. So investment, please invest in yourself, invest in others, invest in something that is worthwhile. Don't get tired. Continue investing, continue to believe in yourself, continue to improve on yourself, and continue to have to make deliberate effort to remind yourself, even when it gets challenging, it gets hard, on the purpose why you're doing this. Continue to remember that you're in public service. Thank you.
Thank you, Doctor. Indeed, lifelong learning. Dr. Akanimo.
Yes, so for the first question, the topic from the program that really changed my mindset is relating to harnessing digital technology in a way that is truly transformational. Just like I mentioned earlier, that was taken by Aaron, and the skill that I gained that will carry me forward in my career is stakeholder engagement. I learned that when it comes to success and when it comes to reforms, definitely you cannot do it alone. You need the critical mass. So you need to be able to sell what you want to do to as many people as possible. So I've been able to learn that. And then the message for future leaders, I want to let you know that Africa's future relies on you and on leaders who will continually evolve. So the key thing is keep learning, embrace innovation, seek targeted training that equip you for real-world public sector challenges. Thank you.
Thank you, sir. Absolutely. The application window for the next cohort of the AIG Public Leaders Programme is currently open. If you are passionate about transforming governance and public service in Africa, this is your chance to join a dynamic network of leaders shaping the continent's future. To learn more and apply, visit our website www.Aig-Imoukhuede You can also connect with us on social media, X and Facebook at Aig Foundation, LinkedIn and Instagram at Aig-Imoukhuede Foundation. Don't wait. Seize this opportunity to transform your leadership journey. A huge thank you to Dr. Akanimo Usoro, Dr. Fatima Ali, and Titilola Vivour-Adeniyi for sharing their incredible insights and journeys with us. Your dedication to public service is truly inspiring. That wraps up this episode of Inside the AIG Public Leaders Programme, Training Africa's Change Makers. We hope you have been inspired to explore the opportunities available through this transformative program. I hope to see some of you in the next AIG Public Leaders Programme cohort. Until next time, stay inspired, stay connected, and keep driving change as we close the gap between Africa and the world.